Dear friends, welcome to Know Thyself YouTube Channel. Good morning. Hope you're all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last episode of Know Your Mind segment, we presented an overview of communication disorders by analyzing their nature, characteristics, causes, symptoms, diagnosis, treatment, prevention, and prognosis. In this episode, we briefly consider the classification of communication disorders. Communication disorders are broadly classified into following types: speech sound disorder, language disorder, hearing disorder, central auditory processing disorder, child-onset fluency disorder or stuttering, social communication disorder, voice disorder, resonance disorder, expressive language disorder and mixed receptive expressive language disorder, and unspecified communication disorder. First, speech sound disorder or SSD. It affects a person's ability to produce and articulate speech sounds, which can make sounds challenging to understand, thereby prevents effective communication. Speech sounds may be omitted, changed, substituted, or distorted while spoken. It can impact the affected person's ability to learn, write, read, and spell. These conditions disrupt either speech fluency, that is, the rate, rhythm, and flow of speech, or the speech voice, that is, the pitch, volume, or length of speech. Second, language disorder or LG. It impairs a person's ability to comprehend and use spoken, written, or other symbol systems or language modalities in context. As a result, the affected persons may have difficulties in making others understand what they mean, both in writing and in speaking. Language disorder may lead to problems with, firstly, phonology, that is, the sounds that make up the language systems and the rules governing sound combinations. Secondly, morphology, namely the structure and construction of words. Thirdly, syntax, which involves errors relating to the relationship, order, and combination of words in sentences. Fourthly, language content, which refers to semantics, that is, meaning of words and sentences. And fifthly, language function, which implies using and understanding language beyond its literal meaning and in its interactional context. Language disorder is not related to hearing loss, motor dysfunction, intellectual disability, global developmental delay, or other medical or neurological conditions. Third, hearing disorder. It is the consequence of an impaired sensitivity of the auditory system. It involves difficulties in detecting, recognizing, discriminating, comprehending, and perceiving auditory information. For example, a person with hearing disorder may be deaf or have partial hearing loss. Fourth, central auditory processing disorder or CAPD. It is not a hearing disorder because it is the result of problems in processing auditory information in the brain area responsible for interpreting auditory signals. It is not as the result of an intellectual impairment or hearing sensitivity problems of the ear. It affects how a person analyzes and uses data in auditory signals. Fifth, child-onset fluency disorder or COND. It is commonly known as stutter. It consists in the child having problems in speech flow and fluency that are not appropriate for a child's age. This disorder disrupts the natural flow of language and manifests itself in repetition or prolongation of speech. Those who suffer from this disorder hesitate to speak or use monosyllabic repetitive words. Hence, they experience anxiety about speaking either in a conversation or in front of a crowd. The symptoms are not constant but can flare up if the speaker feels anxious, stressed, or self-conscious. Sixth, social communication disorder or SCD. Social communication disorder does not focus on articulation of words, phonics, or order of words, but consists in a person having trouble understanding and using verbal or non-verbal communication for social purposes. Thus, persons affected by social communication disorder, though able to articulate well, and have no issues in understanding grammar and flow of sentence, they lack proper ability to communicate in social situations. It revolves around pragmatics and social understanding. Pragmatics refer to using language in the right context. For instance, speaking to a friend and speaking to the boss are different. Not recognizing the need to change the way we speak to different people in different contexts is a sign that someone has this disorder. Social understanding consists in one's difficulty in following the rules of conversation or not understanding things that have not been said explicitly. As a result, the affected person has difficulty in grasping the subtle part of a conversation and picking up non-verbal communication that accompanies the conversation, leading to difficulties in letting conversations flow or responding to other people's thoughts and ideas. Seventh, voice disorder or VD. Voice disorder is related to phonation, which consists in the production of voice when air from lungs moves up through and vibrates the vocal folds. Voice disorder involves problems in the process of phonation, which makes the voice to be harsh, hoarse, raspy, croaky, breathy, and cut in and out. Voice disorder can make the voice too loud or too soft, lead to sudden changes in the pitch being inappropriate for the child's age or gender, brings about breaking of voice and let frequent loss of voice happen. Voice disorder can be due to vocal nodules, cysts, papillomas, paralysis, or weakness of the vocal folds. Eighth, resonance disorder or RD. Resonance disorder is related to the overall quality of the voice. A resonance disorder occurs when the quality of voice changes as it travels through different shaped spaces of the throat, nose, and mouth due to the malfunctioning of these organs. Resonance disorders include, firstly, hyponasality or denasality. This happens when not enough sound comes through the nose, making the child sound stopped up, which may be caused by a blockage in the nose or by allergies. Secondly, hypernasality. This happens when the movable or soft part of the palate does not completely close off the nose from the back of the throat during speech. As a result, too much sound escapes through the nose. This can happen due to a history of cleft palate, a submucous cleft, a soft palate, or power movement of the soft palate. And thirdly, cul-de-sac resonance. This happens when there is a blockage of sound in the nose, mouth, or throat, resulting in muffled or quiet voice sounds. Ninth, expressive language disorder consists in the patient finding it difficult to communicate by both oral and written ways, although language understanding would be within normal limits. It makes speaking difficult. Thus, it involves developmental delays and difficulties in the ability to produce speech. Mixed receptive expressive language disorder consists in the patient finding it difficult to both receive and produce language. It makes both understanding language and speaking difficult. So it involves developmental delays and difficulties in the ability to understand spoken language and to produce speech. Symptoms of both of the disorders can vary from mild to severe. 10th, unspecified communication disorder. It applies to children who exhibit some of the symptoms that are characteristic of other communication disorders. However, children with unspecified communication disorder do not meet the exact diagnostic criteria of any other communication disorders. In the upcoming episodes, we will attempt to analyze each of the above mentioned types of communication disorders in detail. Thank you for watching this video. Stay blessed until we see you again with another video.